Integrated MCQs means one system being associated with other. For example, neuroanatomy, neuroradiology. These are the questions which are increasing in NEETPG. Hello one and all, myself Dr. Dhruv, a neurosurgeon and a passionate PG teacher. My journey in this PG entrance, I can simplify it in the form of being not qualified in first attempt to getting 2000 rank in a government general surgery seat to scoring all India rank of 75 in my first attempt in NEET SS. So that's why I have dedicated myself to teaching NEET PG. Now, as I said, integration of nervous system CNS to other systems has been increasing, and that's why we'll be learning CNS through and through from neuroanatomy to neuroradiology. Let's start from outside to inside. To reach the brain, first we have to traverse a lot of layers. So let's start with the scalp. Let's study scalp with the help of this MCQ. All of the following are layers of scalp except skin, periosteum, galea and dura. Looks a very simple question, but it's not. How? So let's unlayer the scalp. Unlayering the scalp and the brain. Now it's a very old mnemonic which we have been studying since ages, that scalp has 5 layers starting from SCALP, but MCQ doesn't work like that. So from outside to inside we do have 5 layers, but I want you to remember it like this. Skin is okay. C, connective tissue, you have to remember it's a dense connective tissue. A, aponeurosis is nothing but the tendinous attachment of the two muscles occipital and frontalis, which we also call it as Galea. L stands for loose connective tissue and P stands for pericranium. But the MCQs coming from this are 2. So how do we learn it? First, starting from outside to inside, as I said, arteries. So arteries are present in dense connective tissue. And how do we remember? Arteries are densely adherent in dense connective tissue. So there is one more question. Why does a scalp bleed profusely? So just look at this. Arteries are attached very densely in dense connective tissue and hence they fail to contract. So once injured, it will bleed to death. What about veins? Veins are located more inside. Where are they? They are located in the loose tissues. So they have nothing to do with bleeding, but the importance is they allow spread of infections from inside to the brain. So that's the important point. So now we know all of the following are layers of scalp. Skin, yes. Periosteum, yes. Galea, as I said, Galea aponeurotica or the aponeurosis. What we study? A in our mnemonic, and dura. Dura is not one of the layers of scalp. So that's the answer. Now each layer has its significance and one significance for each layer. So from outside, skin, we have sebaceous cyst. Connective tissue we already learned. Arteries, which are source of bleeding. Loose areolar tissue, emissary veins, spread of infection, and periosteum. But the questions which can come is from this layer, Galea aponeurotica. What is the other name for Galea? It is also known as helmet of the scalp, and it's a most important layer for wound closure, and it is continuous anteriorly into the eyes. Remember this point. The next question is going to be from this one. So hemostasis in scalp is best achieved by, put your attention, best achieved by direct pressure, catching and crushing the bleeders one by one with the help of hemostats, eversion of Galea, and coagulation of bleeders with cautery. Now if we analyze each and every option is correct, but what is the best method? And remember one more myth, that the longest option is often right. Not in this case. If we see like that, this should be the answer, but it's not. So if you see the layer Galea, Galea is the layer below the dense connective tissue, and if you evert the galea, the arteries which are present in the dense connective tissue which cannot contract on their own will be controlled by eversion of galea. So this is how a needle passes. This is also one more question. What is the angle of needle to skin? It is perpendicular or 90 degrees. And this is one more question, Jenkins rule, which I'll be dealing in detail in the next video. So what is the importance of Galea? As I said, helmet of the scalp, wound approximation, because it reduces the tension over the wound and helps in hemostasis. So that brings to our question and its answer, eversion of Galea.